5-minute exercise for harder erections and longer sex. Originally developed by Dr. Arnold Kegel in the late 1940s to help women regain control of their bladders after childbirth, pelvic floor strengthening exercises apparently can also treat erectile dysfunction and prevent premature ejaculation in men. They target muscles that support your pelvic organs, like the urethra, rectum, prostate, bladder, and bowel, and get the blood flow to your groin. As men age, their PC muscles get loose and weaken. Apart from aging, a sedentary lifestyle, prostate surgeries, obesity, and other lifestyle factors may reduce the puberectalis tone. This consequently affects your bladder and bowel control, as well as sexual performance. But just as you can strengthen your muscles in the gym, you can improve your PC muscles with Kegel exercises. Studies have found that Kegels can improve sexual function, such as erections, orgasms, and ejaculations. This workout is particularly effective for ED and PE, provides incontinence relief, and increases orgasm intensity. The training is especially effective in men with chronic prostatitis, chronic pelvic pain syndrome, and those who have undergone prostate surgery. The only tricky step is identifying the muscles you need to work out. If you're new to this, or if you just don't work out much, your pelvic floor muscles are probably not in their best shape, so it might take some time to figure out how to flex or relax them. The easiest way to find your pelvic floor muscles is to try and stop the urine stream. Did you feel something tighten somewhere between your scrotum and anus? Here you go. These are your pelvic floor muscles. The greatest advantage of this practice? You can perform Kegels anywhere, and it takes just about 5 minutes of your time. Yet the key to obtaining the outcome is frequency and consistency.